Hello, welcome back to Dr. Hayatu's medical session. Today we'll be discussing an important topic, esophageal cancer. Before we begin, don't forget to hit that subscribe button and ring the notification bell to stay updated on our health content. Let us begin. Esophageal cancer occurs when cells lining the esophagus mutate and grow uncontrollably. The esophagus is a foot-long, hollow, muscular tube connecting the throat to the stomach, responsible for carrying food and liquids during swallowing. Types of esophageal cancer. Esophageal adenocarcinoma originates from glandular cells in the lower esophagus. Risk factors include heartburn, also known as GERD, obesity, smoking, and Barrett's esophagus. Esophageal squamous cell carcinoma arises from squamous cells in the middle and upper esophagus. Risk factors include smoking and alcohol consumption. Gastroesophageal reflux disease, or GERD, occurs when stomach acid flows back into the esophagus. Chronic acid reflux damages the esophagus lining, increasing the risk of adenocarcinoma. Barrett's esophagus is a condition where the esophageal lining changes due to chronic acid exposure. It raises the risk of adenocarcinoma. Tobacco and alcohol use, smoking and heavy alcohol consumption significantly increase the risk of both squamous cell carcinoma and adenocarcinoma. Obesity, excess body weight, especially around the abdomen, is associated with a higher risk of esophageal adenocarcinoma. Dietary factors. A diet low in fruits and vegetables and high in processed meats, spicy foods, and hot beverages may contribute to esophageal cancer risk. Achalasia, a rare disorder where the lower esophageal sphincter doesn't relax properly, leading to difficulty swallowing. Achalasia increases the risk of squamous cell carcinoma. Human papillomavirus. Certain strains of HPV are linked to esophageal cancer, particularly squamous cell carcinoma. Environmental factors. Exposure to certain chemicals and hot beverages at high temperatures may play a role. Age and gender. Esophageal cancer is more common in older adults and men. Genetic predisposition. Family history of esophageal cancer or related conditions may increase risk. Symptoms of esophageal cancer are difficulty swallowing, which is often the first symptom as the tumor grows and obstructs food passage. Painful swallowing, where there's discomfort during swallowing. Indigestion and heartburn, which are persistent symptoms over time, and throat or chest pain, pressure, or burning. Investigation endoscopy involves the visual examination of the esophagus using a flexible tube called an endoscope. During an endoscopy, a biopsy may be performed where tissue samples are taken for further analysis. Additionally, imaging techniques such as CT scans, PET scans, and barium swallow studies are employed to get a detailed view of the esophagus and surrounding areas. Management surgery is often required to remove the tumor and the affected tissue. Chemotherapy and radiation may be used either before or after surgery to target cancer cells. Palliative care is also essential, focusing on managing symptoms and improving the quality of life for patients. Esophageal cancer prevention involves several strategies to reduce the risk of developing this type of cancer. Here are some key measures. Quit smoking, as it is a significant risk factor for esophageal cancer. If you smoke, consider quitting to lower your risk. Limit alcohol consumption because excessive alcohol intake is associated with an increased risk of esophageal cancer. Moderation is essential. Maintain a healthy diet by including fruits, vegetables, and whole grains, which provide essential nutrients and antioxidants that may help protect against cancer. Avoid certain foods such as citrus fruits, tomatoes, spicy foods, and fried dishes. Opt for soft foods like pudding, applesauce, and smoothies. Exercise regularly, as physical activity supports overall health and may reduce cancer risk. If you experience symptoms like heartburn or acid reflux, consult a doctor promptly, as untreated GERD can increase the risk of esophageal cancer. Remember, while these precautions can lower your risk, there's no guaranteed way to prevent esophageal cancer entirely. Regular checkups and early detection are crucial. If you found this information helpful, subscribe for more health-related content. Thanks for tuning in, and until next time, stay healthy.